This is intended to really be an informal opportunity for our leaders in the middle school and high school to be thinking about what are the conditions that are going to be necessary from a public health perspective to try to determine how to bring kids, right, students back into school. Lisa Santora is here with us. And I'm sure most of you have met her before. She's our public health officer. So we really intend this to be informal opportunity for you to ask direct questions. If you don't mind, if you will just, we can put some in the chat, but you can also be asking questions of Dr. Santora. We're going to start though with just taking a real quick peek at the part of the 30-point plan. So there's a plan, right, that describes high school, middle school cohorts and what the option could be. And so if I could have someone bring that up for just a second. Okay, there you go. So I think everybody's aware, and I mean, I know you are aware that there's a 30-point plan. That is the foundation of all of your school site specific plans. 90% of the school, public and all of the private schools in Marin County have already submitted their plans. That is a great place to look online, and you can see what others have identified and how they're dealing with this section. So Lisa, I'm just going to review. So this is guideline number 12, right? Which essentially says larger cohorts made up of students from more than one classroom may be arranged as long as accurate attendance data for students and adults is maintained on a daily basis while avoiding school-wide mixing of students. So that is one of the actual guidelines that people have addressed in their school site a specific plan. And before we go to these examples, could we go back so I can actually see Lisa? And Lisa, let me ask you to make just some general comments. And so you have about 60 people representing public, private, independent schools. And so the topic is middle high school, a secondary approach. So Lisa, if you could just give some overarching remarks first, and then we'll go to questions.
Well, I just want to first thank all of you. I know how hard you have been working. Mary Jane mentioned at one meeting, we started planning reopening schools the day after, not the day after, well, probably in her head, the day after schools closed on the 13th, but certainly by that Monday after schools closed on the 13th of March to reopen schools. And I know many of you have been working diligently with your teachers and staff to figure out how to do this and how to do this together. There's been some changes, important changes in COVID-19 transmission in our community that I think it really is time to celebrate. We've worked really hard together to get where we are today, which is in the orange tier. We've officially been in the orange tier for 2 weeks, and it's the lowest amount of COVID-19 that is circulating not only in Marin County, but across the Bay Area. And at the same time, to pause and celebrate, you're going to start seeing Dr. Willis issue stronger guidance around individual behaviors, because it really is going to be individual behaviors that are going to drive up COVID-19 transmission, and for us to see a potentially much higher second wave of COVID-19 going into January and February of next year. So it's a time both to celebrate that we've achieved this goal. We have actually less than 3 people per 100,000 testing positive per day. It's 2.9 as of this morning. So it's the lowest amount of COVID-19 activity. So just literally COVID-19 is not circulating in the air, in the environment, in a very significant way that is of concern as of today for surges. And so this really is an optimal time to be having this conversation. when you look at the guidance, there's an area that we changed that's, I know some individuals and schools have been stumbling on a bit, is that when we first issued the guidance in June, and it's when we had a lot less information around COVID-19 activity and research and data, we had a 100 number where we were capping cohorts at 100 at the middle and high school level. And the updated guidance had changed, and it's really based on what we're learning about both school-based transmission, about the strength of school site specific protection plans, which really are proving to be very effective in mitigating the risk of COVID-19 transmission on the school campus, in the school environment. And so that number 100 that was on that earlier document is no longer in play. What Mary Jane mentioned earlier is what our tool really is going to be rosters and attendance, and that will be guiding our strength in our ability to contact trace and make determinations on cohort closures or school closures if necessary. We haven't seen any of those yet, but that's where there probably is both the major shift. So the intention really is to stabilize and structure the school community, and both in practice and at the individual level of students and staff, as well as practice at the environmental level, and which is what is allowing us to remove that cap of numbers, which I know many people are fixated on that 100 number. It really will be dependent on the attendance and rosters. One exciting area, and you might have seen it in the news, I've been working with, no, I don't even say I've been working, I've just been supporting 2 high school students from Branson and Marin Academy who have developed a contact tracing app that's now being piloted at Branson. And so we'll be looking, it's student developed and student informed, where students are self-reporting the non-known activities. So we know which classes that they're in, but if they cannot, and we know what sport they might be participating in, but this will help us identify some of the non-sanctioned close contacts that might be happening to help us inform our contact tracing. And so that being said, we did have Marin Catholic close. That was not due to an exposure to COVID-19. That was due to really strong leadership by Chris Valdez and his team to recognize that there was high-risk behaviors that the school community was engaging in, and being responsive to that and setting a tone and a message of what is expected. That's going to be similar to the tone that you just start seeing from our office, is that we really can control a lot right now of how COVID-19 increases. And so we'll be working together with you on strengthening that messaging, especially as we go into the holidays. So that was a kind of a long-winded overview, but I hope it kind of set to see where we are now, to see what's changed, to see how we're applying new tools, and that we do have high schools on campus now and in receiving in-person instruction, and we're doing okay. And you've probably already seen our dashboard. We'll be updating that weekly with any known school-based transmission, if it does occur, and also with the cases that we are investigating as part of a potential school-based exposure. So that won't include students that have not had any contact. They've been virtual. They happen to be a student that has had an exposure. We will be posting only students and staff who have had a potential exposure event because of their presence on campus with in-person instruction. So there you go.
Yeah, so Lisa, maybe Wes Cedros, I know that you provided several questions that I think would be questions for everybody. Would you mind just going ahead and going through the questions that you had?
Sure, Mary Jane. Let me let me find those questions. Okay. Yeah, so here are the questions that I sent to Ken and Mike that came from our staff. So, is the daily health screen a requirement or a recommendation, and what form can it take?
We are recommending parental home screening. We've seen San Rafael City School District implement a tool for daily screening of students where parents are reporting that their students are presenting, and that information is going to the school, and then the school is managing that. And so that's one tool. But the expectation is, the responsibility is going to really be reliant on the parent not sending that child to school. And we support how schools individually decide which tools they may use to implement or confirm screening. We're not recommending the confirmation of screening. That really is up to the school level. We appreciate that it really could be an administrative burden to manage, making sure parents like me who don't check their emails and don't do what they're supposed to do and completing tasks can be challenging. But I was impressed. I saw last night we had Sarah Fell had a community meeting and had a great app. But at this point, the responsibility is on the parent that they're not sending students to school sick. And if students do arrive to school sick, they will be sent home.
Great. I think in your intro, you answered the next question, which was what's the size of the cohort in the high school setting? But I think that's been taken care of.
I think just the message around that. I'm sorry, go ahead, Mary Jane.
No, I was going to say, go ahead and say more about that, because that is a shift. We've been thinking about 100, I think, in general. And so can you just sort of restate that for us, Lisa?
Oh, what I was going to say is that the 100 was just the number where 100 came from is when we were first trying to conceive of how we would manage from a public health side. So on our side, not on your side, the process of contact tracing and what that would look like for our team when at a time when we didn't have a team. There weren't 3 nurses assigned to a team at that point. So 100 was picked out as a manageable contact tracing number. And it wasn't driven just by it being kind of a safe number of students. It really was driven by our contact tracing capabilities. And what we've seen now in the tools that we now have and the team that we now have, we do believe that 100 was an arbitrary selection. And that really it's going to be up to that school site specific protection plan where, and I don't want to understate at all, wearing face coverings in school and maximizing physical distancing and having those behaviors reinforced on a daily basis with students around hand hygiene, et cetera. I mean, that's going to be our strongest tools for preventing transmission. What we realize in the high school population is, and we all were 17 once, and it's probably one of the most commonly received email I get is that they'll see a gang of 17-year-olds milling about and not wearing face coverings and not distancing. And that's the nature of being a high school student. And that's why we have from the beginning have relied on working with students directly to have them support us in the messaging to both be positive leaders on campus and role models, because that's going to be the behavior of when that's the highest risk is when they're off your campus and socializing and mixing and not maintaining the environment that you have on campus. And just to differentiate that, as long as you maintain the protections on campus and your staff are wearing face covers and maximizing the distance. And I know we've all fixated on 6 feet, but really 3 feet is, and what's used internationally is that 1 meter is maintaining more than 1 meter away from an individual really is that optimal place. And 6 feet is really above and beyond, that's our cautious approach, our conservative approach in the United States. And so I think that's why, again, we've shifted away from that number 100 because the capabilities, and this is consistent in public health. It was the same conversation we had with medical surge, where our hospitals ready to receive and manage patients. And when we picked the 100, was our public health team ready to manage contact tracing when 50,000 students go back online. And we believe we have the tools that are ready to do that, and why we have the site-specific protection plans in place. And now we want to promote the positive behaviors, but don't feel we need to limit that number of cohorting. But we absolutely know many staff, teachers, and then because this is a very common email I get, I'm sure your team will get it more often, is how can it be over 100? The reason it can be over 100 is because we have the capabilities in public health to trace, and we have teams ready at the school level to have attendance records, and we have public health liaisons. We have the tools that we need to be effective if there is an introduction of COVID-19 into the campus.
Thanks, Lisa. I think that leads right into the next question that we had, which was, can you give us, a kind of a clear definition or, a layman's definition, something that we can pass on to parents and our teaching staff about what is whole school mixing, like what is meant by that? And kind of following on from that, since we've talked about it a little bit before, how does contact tracing work? Like, just what are the mechanics? What can people expect?
So whole school mixing in my brain is what I did when I was in high school. I had to get to class, I wandered around, I got to class late, and your students, especially at the high school level, less so at the middle school level, roamed and interacted and maximized socialization in between classrooms. And so now we really are envisioning that the movement of students from class to class will be more structured. And I think that's going to be, again, an educational opportunity for students, and looking at how can you engage your students in those conversations, where that's what increases fear, and is when parents, staff, and teachers see kind of this milling around and mixing and jumping from one class and visiting your friend in this class and then going to that class. Again, all normal activities of a teenager. But now what we see with not mixing is that it really is purposeful movement from classroom to classroom, maximizing distancing as students are going from classroom to classroom, and not having, and really knowing where your students are on campus at all times. So that's my definition. I don't know if you want to add anything, Mike, on the school side of the mixing. The vision I have in my head, you might have seen, is the Georgia hallway, with that high school that opened in Georgia in August. That's the exact opposite of what we expect to see on high school campuses across Marin County. We expect to see all kids wearing their face covers when they are moving, having kind of the signage that we see now in our, figuring out your campus to see which is like a one-way path, and having signage to help kids see the right paths. And again, talking to students as they come back on campus to figure that out.
Yeah,
Mike?
what I wrote down, Lisa, is purposeful movement from classroom to classroom as the key words.
No milling. And then there was another question. Oh, what is contact tracing? Haha, I remembered. I had some short-term memory. So what happens, and this has been happening since March, is we get notice of either a household exposure to COVID.
I haven't heard much from you. First of all, how'd your trip home go?
Hey, Lars. Yeah. Okay, thanks. Everybody mute. Okay,
Right.
sorry.
Back to contact tracing. I didn't go home yet. So back to contact tracing. We received notice from a school, usually it's from a school, usually it's on a Friday or weekend, where there's a known exposure, a known COVID positive. Our email is monitored 24/7 almost, because our nurses don't stop. They do rest sometimes, but you'd be surprised at the times they answer emails and check emails. I think that's all of the new virtual world. And then we initiate contact with the public health liaison or the school administrator to really kind of do our first initial investigation, because not all known COVID positives actually have exposure to school. It really depends on us confirming why they were tested, when they were tested, if they were symptomatic or not symptomatic. And I'm doing that initial investigation to determine if they were on campus at a point that we would have considered their infectious period. Some of the cohort closures that you've seen has been us erring on the side of caution, where it really wasn't necessary, where someone might have been on campus a day before their infectious period. But at this early phase, when there's been any delay in information that we've received, we err on a side of caution. So we confirm first that the student or the staff was present during their infectious period on campus. And then we determine what is their role and how they were moving through the campus. So there's been scenarios where we've had staff who have tested positive, but they didn't have any direct student contact. So just the staff was removed, and then there were no closures because they had no contact with any students, or they might have had other minimal staff contact. And then out of an abundance of caution, often you'll hear us say this, we're still working out of an abundance of caution. So it means we're kind of breaking our own policy to be more cautious and more conservative. We'll have staff get tested and not necessarily quarantine because we're doing testing out of caution. And that's where testing is used as a tool for reassurance more than infection control, because sometimes staff just feel it's like scabies or something. They hear the word COVID and they think they immediately have it. That's not the case. And so a lot of us, the next step is then identifying who are those close contacts. At this point, we're going to treat classrooms, not the teachers. And this is where it'll be really important. I think we're going to learn a lot together. My expectation is that middle school and high school teachers really should be able to maintain 6 feet distance and always wear a face covering. That's not necessarily the case in a TK through 2nd grade level. So there will be an interview of the staff where did you wear your face cover? Did you maintain 6 feet distance at all times or not? And so with staff, we'll have that version to determine if the staff needs to be pulled or not. Because honestly, and again, I understand this might not be the case. There might be a COVID positive student that was having behavioral issues and the staff felt the need at that time to have close contact for more than 15 minutes. And that could happen, but that's not the expectation. The expectation is most staff, if not all staff, should be able to maintain more than 6 feet away from students while they're teaching and should not be considered a close contact of any students. What we then would do is identify the cohort of that student. So recently, and it depends, recently we identified that the only cohort was a sports cohort. And so a sports cohort was closed, even though they should also not really be true close contacts, because even with sports right now, it's only strength and conditioning and being outside and being more than 6 feet away. And that's where, even though that's the rule of the sports conditioning, we opted to err on the side of caution and close that cohort and to treat it as an exposure. And so I think that's going to be the change that you see at some point across the school year, is that we'll be less conservative and less cautious and really start seeking who are those true close contacts so we don't disrupt school. But at the beginning, I would see that if a positive is in an English class, and I'm just using that as an example, an English class at a high school level, a student is confirmed positive, we would then have the students that were in that English class quarantine. So only the students in that English class would quarantine. If there are 2nd generation exposures, would not need to quarantine. We would then quarantine the students in that English class. We'd recommend testing 5 to 7 days after they're quarantined. And then we would inform any future decisions after that testing. And the reason why we have that lag is because you can't test immediately after an exposure. The moment you've had contact with someone that's COVID-19, you test that day, you're gonna absolutely be negative. Your body, let's say you did everything wrong, your body still has a chance with its own immune system. If you did everything wrong, you didn't wash your hands, you wiped your face and you didn't wear a face cover, your body still has the opportunity to use its immune system and to mount a response that you never develop a COVID-19 infection. That's what your body does all flu season. In years past, when you weren't wearing face covers and you weren't weren't maintaining physical distancing. So that's why we wait the 5 to 7 days for testing to see who actually is going to develop a COVID-19 infection. Even if individuals, and I say this a lot, even if individuals who are identified as quarantine, if they test negative, they still need to maintain that quarantine right now for the full 14 days. This might be an area that you see a change. There's already conversations happening at a regional and national level is testing at 7 days and ending quarantine after 7 days if a negative test. And the reason that conversation is happening is because more than 90% of people, probably close over 95% of people who have been exposed to COVID-19 who will develop an infection will test positive by day 7 and will actually not be infectious by that point. And so that's something that's still evolving, but just planting a seed for future changes and us being less conservative. Sorry, that was a long-winded answer again.
So Wes,
yeah, I think just maybe one more question it's 2 questions that are kind of related. And we were asking, I think Lisa touched on it a little bit when she talked about sports. So for PE classes, currently, is the protocol the same that our sports teams or cohorts are following, like proximity, sharing balls or equipment? And then similar to PE, what about common supplies like art and science supplies?
We're recommending for PE, it's the same as sports. It really should just be strength and conditioning outside as much as possible, maintaining 6 feet. And there's been some debate. It really depends. Students who are outside and can maintain 6 feet apart do not need to wear face coverings. we've seen some schools opt to wear face coverings. It just reassures, it's very reassuring for staff and parents, especially those, everyone's on a different spectrum of COVID fear. It's like a rainbow. And so it's very reassuring to see everyone with the face covering on. So we would not oppose any school that opts that even when kids are outside to wear a face covering on campus, even if they're more than 6 feet apart. That is absolutely allowable. And again, it's really, I think, all of us working together to demonstrate good practices and reduce fear and anxiety and worry when people see people without a mask, it trips them out. But they should still be following the state sports recommendations. Then with arts, we really are recommending personal supplies. I think this is where there'll be more information. There's a lot more research that will be available. COVID doesn't seem to really live on surfaces. It's not the primary way that we're seeing transmission, and evidence is really increasing around that. But we've shifted towards such, emphasis on disinfection and hygiene, and that I think in some ways it's really increased fear. It's increased fear about touching things. So that being said, we're just navigating this next phase of our understanding of COVID, where as much as possible with art supplies, we would recommend personal art supplies. Again, it reduces fear, anxiety, and worry. There'll be more research that's evolving that shows that, fomite transmission isn't possible. And I think we'll be shifting back into our normal practices that's in months ahead. But now is the time with art to just as much as possible identify their own supplies or have some cleaning mechanism out afterwards. But this definitely is part of, the term is starting to buzz around as I think it's called hygiene theater, where again, how much is really effective and useful and how much is more the theater of what we do. At this point, we would still, again, recommend individual supplies as much as possible. Then the last thing, and just to touch on, we are reviewing music guidance. I know music is a really important part of campus life, especially at the high school and secondary school levels. The state hasn't updated their guidance. There is a University of Colorado guidance that allows for covers of woodwind instruments. So drums are fine. You can beat the drums, not going to splash up any COVID, but woodwind instruments are of concern. So the term bell covers, that's what they're looking at. So we've seen Fresno County release guidance that is a little bit shift away from the state, which is saying no band and no music. Their guidance is allowing for music and band with bell covers. So we're reviewing that right now with the state and with the Bay Area health officers to see if we're ready to pivot to this approach, which will allow for some music. If you look at, I'm just very biased as a former flautist, I wasn't that good, but it's not a comfortable bell cover operation to play the flute. Again, these are projectile respiratory droplet events when you're blowing literally or singing loudly. So these are higher risk events, and in local experience, one of our TB outbreaks way before COVID came from bands who were playing musical instruments and singing. And that was one of the mechanisms of tuberculosis transmission. So we're a bit more cautious even in Marin County. Sorry, another long answer that you made me think about music.
Lisa, can you just answer a question about what's your opinion about sharing textbooks?
This is when I'm researching. Again, where we are in research is we're really beginning to see that COVID doesn't live. They're detecting, we have better tests than we've ever had. It's this PCR test that detects genetic material. But just because you detect genetic material on any surface doesn't mean it's infectious. And so we're going to be re-reviewing specifically around books. Our libraries have this 4-day rest period for books, which I believe is very excessive. That was the best practice though, when libraries first began to open and started circulating books months ago. So we're looking at that, but I don't have a defined hours or process yet for books, but we're looking into that. And again, that's really based on emerging evidence that COVID it's not the hardiest virus. It really likes being wet and moist. And so it's more likely the way you're going to get it is if you touch something like like how we used to do it. Like we used to pick a phone up right after someone else spoke on the phone and it didn't bother you. That would be the way you would get COVID-19. It's not because you touch a book that's been sitting for a couple hours and then you wipe your face. It really, COVID likes moist, warm environments. So more to be seen. Sorry, I don't have the answer on that today.
Lisa, could you address this issue of physical distancing continues to, this has come up every call for a long time. So this is coming up again. You sort of addressed it, but one more time. Do you believe that physical distancing guidelines are going to be minimized? But could you go through again the 3 foot, 6 foot thinking?
So the 3 foot, this 6 foot is the big round erring on the side of caution. Think of how far you are away when you're 6 feet some moment. That's like outside really the realm of a droplet hitting you. If you're talking to someone, you have someone that's a spitty kind of talker. And so that's where the CDC has landed on the 6 feet distance. The research that we've seen mostly though is internationally, and it's been using more than a meter, where being beyond a meter of an individual is really when you see the risk of contact decrease. And that's research done without wearing face coverings. So we're having not only more than 6 feet as our standard recommendation, everyone's wearing face coverings. If students are in a classroom and they're facing forward and we are maximizing this, I think we use 4 feet as our, keeping students 4 feet away from each other facing forward. That really is not creating the environment that you would need to have COVID-19 transmission. So again, it's a structured environment that is a safer environment and for preventing COVID-19 transmission, if it happens even to make its way into that classroom. And I think that's where we have all these other protections in advance with screening, access to testing, surveillance of staff to really prevent COVID-19 from entering the school environment first. It is going to enter. We've seen it enter. But again, having that stable, structured environment where students have to play a role in it. They can't just mill and gather in the classroom like they used to. They need to, again, purposely move to their desk, maximizing distance, then sitting at their desk with their face coverings on. Recommend, and I know in the high school setting, they'll be going from a classroom to classroom. So integrating that there is some way that they're wiping down their desk before they leave their desk. They should have some responsibility for that as well, but it's up to each individual schools to allow by the time the next group comes in, they'll be able to safely inhabit that classroom. And again, in a very purposeful, structured way where kids aren't sitting on their desk and hanging out like they normally used to.
Right. Superintendent Hogaboom, you had a question?
Long time no see. Hey, Lisa, thanks for coming to our town hall last night. So just to be clear, I mean, maybe you've already covered this, but so can you bring back a class of 30? Or are you still recommending 15, or does that just depend on the cohorts? And then you can have 3 or 4 classes a day?
Yes, you can bring, as long as you can have attendance and you know who's in each classroom, you can have normal classroom sizes. And I mentioned earlier, when we were developing the June guidance, which had some caps, it was really based on our public health capabilities. And now we have a team of 3 nurses, 3 administrators on our side, and trained public health liaisons who we meet with weekly. And we're always ready, willing to expand and hope identify more staff who build their confidence in managing the COVID-19 exposure. We believe now we have the capabilities that further support us not having restrictions on classroom size.
So as long as
good attendance is in place, good attendance practices are in place.
Okay, and as long as we can spread them out, at least a meter or 4 feet or whatever, then that's
Or at least
the key
4
thing.
feet. Mm-hmm.
And can you have 6 classes a day?
Mm-hmm.
Wow.
Yes.
Okay.
Okay, but Lisa, let's just go with that for a minute. So we might say that, but we know that as people are thinking about this and we're trying to do our best to make sure our staff feel safe and our students feel safe and our parents feel safe, there's a lot of data that we've seen about the difference between little kids and older students in terms of COVID. So can you talk about that a little bit?
Absolutely. We are seeing that COVID in adolescents, so that's really the greater than 14, for the 14 to 18 age group behaves a lot more like adults. So in kids, we see kids that are infected with COVID-19 have very low viral loads. They don't mount many symptoms that help in the transmission of COVID. Again, like I think some people conceive it's like you breathe and COVID is coming out. That's again, it could happen that someone gets infected if you're breathing right on somebody, but it really is the sneezing, coughing, respiratory droplet producing, expectoration that you then catch by someone sneezing or coughing into your face, and then you wiping it into your hands. So that being said, in the little kids, we don't see that. We don't see kids mount these symptoms like that. They're not coughing, they're not sneezing, they're not having runny noses with COVID. It can happen, but it's not common. And when they do, they have a very low viral load. What we're seeing in the, especially the 13 plus adolescent population is it does behave more like adults, where they do cough more, they do have more respiratory droplets, they do have higher viral loads. So the population of kids coming into school, if they were symptomatic, would have a higher, if they were symptomatic and infected with COVID-19, would have a higher likelihood of potentially passing an infection. And again, that's why we have face coverings, why we're trying to maximize this distancing, and why we're trying to have, very structured, purposeful movement on campuses, because it takes a series of events, a chain of events for COVID to go from one person to the next person. But absolutely, and we understand this has been probably the other common email that I get, I'm sure that you're getting, is like, well, how can you let high schoolers come back to school? And I think where you have been focused as leaders has been the right focus. It is focusing on the littlest kids. They have the lowest infectivity rate. They are the lowest risk for transmitting it to anyone. We've proven successful, and we need to get the littles back. But I would say just as much, just remembering what I felt like when I was in seventh grade or 17 years old. We also think it's beneficial for students to get back onto the classroom, even as adolescents. And we believe we can create a safer environment to support that. And again, we understand there's fear, worry, and anxiety at every step of the way. So if a school opts to have smaller class sizes or have hybrid mixes, we're fully supportive of any model that you feel works best for the culture of your school, parents, teachers, staff, and students, and phasing that in. Because the other caveat of where all this is, and I mentioned it earlier, is we're planning for a second wave. We don't believe that Marin County residents are going to behave and follow every public health guidance, and that we can prevent what we're seeing on the East Coast from coming into our community. And so we also need to be prepared again that we might have a recommendation in late January or February for return to virtual learning. I'm hoping that doesn't happen, but I see that this is a great window right now when we have the lowest amount of COVID-19 circulating in our community. We have school site protection plans in place to get our adolescent kids back in, and to have some controlled socialization and in-person instruction is just as important.
Lisa, there have been some questions that have come up about whether you recommend after the December break that we don't come back that we stay virtual for 2 weeks.
We're reviewing that guidance right now. Just before I jumped on this call, we are planning on issuing a travel advisory. And it may be a Bay Area travel advisory where we've almost flip-flopped again. There was a point where the CDC took away all the travel advisories because COVID was everywhere and everyone was dealing. It didn't matter where you traveled, you had to just assume it was highly prevalent everywhere. We're experiencing a condition now in the Bay Area and probably California at large that of where New York was when they were restricting travel from California into New York. And so we are going to be looking at issuing travel advisories. We're also going to be looking at providing guidance for parents around higher risk travel. And if they do travel, not only it's the traveling, long haul travel, so a longer plane flight, but also what they do when they land. Are they going to be doing Christmas like usual or Thanksgiving like usual and having 5 different households convene indoors? Then that family should quarantine when they return. The reality is though, probably 70–80% of individuals will follow our recommendations and will not engage in high risk behavior. So at this point today, things can change quickly, as you guys know, with COVID. We're not recommending a quarantine. We are planning, as of today, strong specific messaging around what we're calling high-risk behavior for families during the holidays, and then recommending that those families who engage in high-risk activities quarantine at home at this point for the 14 days. But we are hearing from schools that are opting for a quarantine period. The reality of if we look at chronologically, I'm going to get a little sciencey nerdy for you. If we overlay our first wave with the European wave, what we're expecting is that January 28th is going to be when we start really peaking up in a second wave. That could be accelerated to mid-January, where because of the behaviors and the travels of residents. So we could be looking at a scenario that you're quarantining, and we're still going to potentially close schools at that point. I can't forecast it. It's reading tea leaves a bit, but that's the worst case scenario we're planning for, is a late January second wave beginning. So as of this week, we're not recommending a quarantine. We're going to be moving more with communications and clearly specifying the risks that those families should quarantine if they're engaging in those risks. That being said, if we start seeing changes coming from the Bay Area, it might be a tool that we do recommend. So sorry, that was a wishy-washy kind of answer, but I think it just shows where we are.
So I think I've been able to get to most of the questions. Any of you that have questions, please ask them, even if it's not your question, but you've heard about it. We're recording this session, so it will be available to others to listen to. So it's helpful if we get as many questions on the books as possible.
I think where we're at in Novato Unified is the cohort numbers are great. That works for us. We like the languaging around that. Where we're finding a pain point is the 4 to 6 foot distancing. And so, kind of what I'm wondering is, if we do screens in front of students, those plastic screens, is there ways to bend that 4 foot thing? But I think that's our pain point now as a system.
Well, if you have those plexiglass, those are really effectively, it's a wall. I mean, I know students could lean back on a chair and then sneeze or cough, but again, they should be wearing a face covering. And I think we have so many protections in place. So I think that the plexiglass would even support, the 3 feet number, of a classroom, because you really are minimizing that. And we've seen that be effective in South Korea. I think was one of the first countries that adopted the plexiglass. But you can contact us offline if you're envisioning a classroom with less than, and it's also, what are you less than 3 feet from? Even the desks themselves, I think it's less than 3 feet from like head to head, so probably most of your structures of your desks, especially if you have plexiglass, would be a much contained environment. Again, with the presumption that would be even if someone wasn't wearing a face covering and wasn't washing their hands and came in sick with COVID, it's not going to transmit easiest in that environment. It's another layer of protection you could offer. We're not recommending the plexiglass. We don't think it's necessary, but it's absolutely an option for reassuring, and it would create a barrier. And we're seeing it more commonly, as you see everywhere you go now. There's a plexiglass barrier.
Mm-hmm.
I'm sorry if you had already answered this question earlier. I jumped on a little bit late, but I know, is it necessary to have prescribed one-way routes throughout campus? I know that part of our SSSPP, that was one of the things we were asked to submit. So I have that. It just, I don't know, I guess I kind of view it as a supermarket where kids are just passing each other to get to their classrooms. If we discourage loitering and if they're purposeful about getting from one place to the next, is it necessary to have them follow prescribed one-way routes?
No, it's not necessary. And I think it's really going to be based on campus to campus. And it's just that we've seen wayfinding or pathfinding as a helpful tool when people are queuing up outside of a classroom. That's our biggest goal, is trying to, and I saw it on the Glenwood Elementary, they place kind of G's everywhere, 6 feet apart, because visual cues are really helpful for people of all ages on how far they could spend apart. So as long as you have like visual cues and supports, it doesn't need to be one way if you can just prevent that milling congregation potential.
Mhm. But Stephanie, just to say a little more about that, those school site plans were developed, right, in collaboration with all your stakeholders. And once you identify something like we're going to have arrows providing direction, that could have been the difference for a school site for people to feel comfortable that there would be some structure about how students are moving between and among classes. So you can also think of it in that way as a piece of data that helped the school consider reopening in a way that the teachers and other adults and students felt safe. So just a different way to think about it.
Thank you.
And I think that part of this, and I don't want to say this, and I know I'm being recorded, but part of this is our theater. Like we really need to demonstrate we are committed in creating this as safe environment as possible, because everyone's on different places of fear and that fear, anxiety, worry spectrum. And it is, and we'll get to a different place once we learn more, know more, even at the local level, also at an international level around this disease. But those visual cues, even as a parent, when you see those things, those changes being made to the environment are just reassuring. And I think that's also part of the, it's the winning hearts and minds of people that may be fearful. Those tools are just helpful tools. So.
Glenn Dennis from San Rafael High, you have a couple questions?
Yeah, I just had one question, Mary Jane. Thank you. I was just wondering if these new recommendations, they change the cleaning protocols for between classes, or for like how often do restrooms need to be cleaned or sanitized?
I don't think they're new. That might just be my view. It's like when I go to a new desk, even though it's the one I sit at, I wipe it down. And so I think we have a general language around enhanced disinfection and cleaning measures. And I think I just gave kind of a specific example where it is a good practice to wipe down a surface, especially if it's a shared surface. So it's not a requirement that every child has a wipe, because they're also, I mean, that's the other thing, is also trying to be green too. But what's the best way that we can, again, just keep clean surfaces when people are using shared surfaces? So.
Great. Okay, Kimberly Bierman, do you have any questions from your perspective?
Thank you for asking, and thank you, Dr. Santora. We really do appreciate this session today. I think that most of our questions have been answered. We are very curious about the distancing in the classroom, because for us to even ensure 3 feet, most of our classrooms won't fit that. So I think it would be helpful if we'd be able to see what all of the schools, middle schools and high schools would be doing across the county, because I know that there's a lot of conversation about that. So maybe that's something that Mary Jane, your team could help with.
Sure. Okay, great. Okay, David Sondheim, since I can see you, any questions? No? How about Nicholas Miller? Nancy Lynch? All right, anybody else? Question that you can think of that you want somebody to hear the answer to from Dr. Santora, even if it's not your question?
Yeah, I think, go ahead.
Oh, great. Hey, Marcy, go ahead.
Thank you. With the moving to the tier 3 orange, and there's likely, and I understand it may be coming out by the end of this week, is a new decision tree for schools related to tier 3. Given that we're just transitioning into in-person, and all of our staff is used to right now the tiers 1 and 2 decision tree, at what point would you recommend immediately, or after a week of transition, just as people get kind of used to having kids back onto campus, that we move into the tier 3 decision tree? Or when will it be released?
We're meeting with Marin School Nurses Organization today at noon. We hope to post and release the English version today. It's probable, hopefully the English and Spanish will be posted no later than tomorrow. I know some schools, and we talked about this with San Rafael, they already developed a system or they already developed forms. So I think it's reasonable to take a couple of days just to kind of adjust whatever protocol you've developed and workflow that you've developed to implement. But I wouldn't recommend, I would say my recommendation would be as soon as possible, because there'll be natural conflict between the provider community. We're going to be releasing both the guidance and the public health advisory that goes to the providers in the community. And and maybe just to communicate with parents that you will be using tier 1 and 2 until a certain time. And so everyone knows what environment they're working in. And the decision, what shifted us, again, this was planned. We lagged in getting the tier 1 and 2 posted, and our apologies for that. We were really trying to cull from what was happening nationally and internationally, and it wasn't coming as fast as we would have liked. But it really, and this is Mike Grant's favorite medical term, it's really around the pretest probability around symptoms that are driving this decision tree. We now have a much stronger definition from the CDC of the clinical criteria for what would constitute someone to need evaluation for COVID-19. And that's now based on hundreds of thousands of individuals that have been affected with symptom tracking, et cetera. And so the likelihood of a sniffly kid with no known exposure and no high risk behavior having COVID-19 is now extremely low in our community. And so that's the intentionality behind our shift to this, it is a bit more relaxed, but now it's fully aligned with the Centers for Disease Control definition of the clinical criteria for COVID-19. It also recognizes that the prevalence of COVID-19 circulating in our community is a lot less than the other seasonal viruses that are circulating right now. And there may be parents that, oh, my kid is sniffly, and I think there's two sets of parents. There's a couple sets of parents. One set of parents, like, my kid's sniffly, I want a COVID test right away. That's one group of parents. One group of parents, like, my kid is sniffly. We've been doing everything. There's no way this child has had a COVID-19 exposure. So they might call their doctor or just send them back to school after the kid's feeling better. Or there's the sniffly kid who parents did engage with the party and they had everyone and gathered indoors, and that family probably should err on the side of caution. We address that by the exposure. So anyone that has a known exposure, and I think we'll be providing more specificity around risk. So not just known exposure, but also engaging in high risk behaviors, then parents really should consider. And I think I've seen it already, like, people get that gnawing feeling like, oh, I did something I shouldn't have done, and now I have a sore throat. Most times it's not, even in that scenario, it's not COVID-19 in our community. Most times it's still a sore throat, but it's usually, there is a risk of higher risk behavior. So not following state guidelines and having an indoor party with more than 3 households is going to place you at higher risk. So I think that's just to frame where we are with the shift. We will provide more risk specific information, but our concern again is just that discord that you'll have in the parent provider community when they were saying, well, why aren't you following this? So just be proactive. I would recommend just being proactive in communication.
Perfect. Thank you.
So Nancy Lynch, yes.
Yeah, I received a tier 3 decision tree yesterday with yesterday's data.
Oh, you got a preview. It's not final yet.
Oh, it's not final, so I shouldn't put it in my newsletter to parents yet?
Not to, when your nurse tells you after the MSNO meeting that it's final. So it's not, I wouldn't put that in the newsletter yet, no.
Oh,
you got the inside scoop.
It was ready to go out like now.
Okay. No, I would wait. Dr. Willis hasn't finally, he's approved it. We're waiting to hear back from the nurses and some providers are taking a look at it. So there might be some refinements, but it's close.
Okay.
Don't send out yet.
Don't send out. Thank you.
Dr. Santora, can you clarify the new guidance from CDC on what the definition of a close contact is? I understand it's a cumulative 15 minutes within a 24-hour period, and within 6 feet, but is that with or without a mask?
It's still, we're not considering face mask use so it's with or without a mask.
Okay.
The 15 minutes is, I was actually surprised the CDC went this far. It was based on one research of in a correctional facility. Correctional facilities have no doors, windows, really are one of our highest risk facilities. They're a lockdown facility. And so it's not unsurprising to find a case of someone that really was around cumulative exposure. Also in these facilities, when COVID-19 is circulating, it's not literally not cleared out. So I was surprised that they went with this cumulative measure. We're finding early on in this week with it being released that we're looking towards probably sticking with our 15-minute measure when we interview people, because once you pose to the average resident, 15 minutes cumulative, it almost paralyzes them in trying to figure out their close contacts. You're like, oh. So we might be even adjusting and start with who have you spent more than 15 minutes with to get that first contact identification. And then after they identify contacts that way, then follow up with, is there anyone that you might have spent, if you add it all together. So it is what is the CD guidance. It is cumulative. It's driven by one case study in a correctional facility where that type of possibility is more probable and not in the natural environment for the rest of us. But that is our new case definition. So we will follow it.
Okay,
Thank you.
Yeah, so Lisa, I think we're gonna be there for now, but just to note, our colleagues at Branson Hall Middle School, Del Mar, who are already open for students, have offered opportunity for anybody who'd like to come visit. So we'll get that information out in terms of a contact. So thank you for offering site visits at your sites. I just want to ask Lisa, this is a special group, and they're definitely going to be dealing with, I think, some specialized issues as they try to figure out, what steps to take so that their staff feels safe, students are following protocols, etc. So we may ask you for another opportunity like this with this group in particular. Would you be willing to do that for our middle and high school leaders?
Of course, you're my favorite people.
She said that to the preschoolers. She said that to the special ed.
Anyone that's getting kids back to school are in my favorite group of people. So I know it's hard to lead these days. I only can imagine how complicated your world is right now. But I just so value all of your efforts. I know you have many sleepless nights and long days and harder conversations than I probably have some days. So anything I can personally do to support you, I want you to feel fully supported. I know Dr. Willis would say the same thing. You're an important group for us too. It is a higher risk. Again, like we said earlier, the students at where their frontal cortex is in their development and their natural behaviors are not the best. It's not going to be the most structured environment, and they do. This is a place where we do see COVID behaving more in adolescents like it does in adults. But we're here, we do believe that we have the plans in place to support a safe return to school. And we are ready to adjust and want you to feel full support from us and our availability as you navigate, tricky situations, hard situations. That's what we're here for.
Right.
And to learn from each other.
So one more question. Our principal at Benicia Valley would like to ask the final question.
Thank you, Superintendent Burke, and good morning, Dr. Santora. Quick question. I deal with a TK-8 setting here, so I'm just curious, based on what I'm hearing, sounds very promising, very reassuring. Would you say that some of the items that you've mentioned here, the recommendations, would also apply to our lower grade level students? And if so, you're nodding your head, that's a great thing. How would that work also, like on a bus? Do we still have to look at separating kids, one kid per seat, or what would your recommendations be there?
I think our transportation guidelines are unchanged. We're still, and I know this is a tough part, especially for your school with transporting kids in. At this point, this is where it is one kid per seat with the windows down. And with face covering. I think we'll continue to evaluate that. We're not seeing, where we normally get stronger movement is in our kind of regional transit centers, and they're having such low use of transit. So we're not getting updated guidance where we can say, oh, Golden Gate did this and we're not seeing disease transmission, and they're managing with this number of kids, number of adults on a bus. So we're not having those kind of transferable applications that are readily available. So the current transportation guidelines stay in place. What we have changes, I think there was some conversations earlier around seat assignments, et cetera. That's not necessary or recommended. And we're not considering the transportation to and from school as a cohort. We will not as a cohort in their lives. So they can still attend school, attend aftercare, and attend another after school program, soccer or art. So that wouldn't count against any student that they don't have an opportunity for other extracurricular activities because they get transportation to school. That being said, if there is a positive case and we had a bus scenario, we would treat that as a cohort and determine who needs to be quarantined. That also might be the place where we haven't done it yet. We're treating at close the whole bus quarantines. It might be a place we get to first where more like what we do with measles on airplanes, we identify who's around that person on the transportation bus and only identify those individuals for quarantine versus the whole bus itself. But that's going to be evolving, and we'll probably be working closely. I'll probably be working with you where we'll have the scenarios where we'll figure out how to best to do it together, and then where we can make adjustments, because our goal again is optimizing time for students in the classroom, and we know transportation is a key part for kids getting there for some of our kids.
Okay, great.
Okay,
Lisa,
thank you.
Yeah, you're welcome. Thank you. Okay, so Lisa, thanks very much. We'll look forward to having another opportunity to talk with you, with this group in particular, as things come up. Appreciate all of you and what you're doing. Please take care of yourselves while you take care of so many other people. Bye-bye, everybody.